You'll be okay. You got this.
And they gain about 3 to 6 ounces a week. So,
Okay.
and like we said, give or take a pound. She's probably gonna weigh about what you weighed.
Okay, all right.
Well, she's like, that ain't very helpful, girl. Okay.
The joke we always say is it's the size of the head. Is there a big brain in there? Because the rest falls out afterwards. So it's
Right,
you know,
I've been looking at my
Well,
husband's head,
her
like, what do
femur
I
is
do?
really long.
she's tall.
So
Yeah.
she's tall. If you have an 8-pound baby that's 22 inches long, girl, that's a skinny baby.
Okay.
Because it's the weight of
Yeah.
the bones, and
Gotcha.
yeah, it's not the
Nice.
big roly polies.
So this would be like just aging of the
Right.
placenta. Like that's normal,
That's normal.
for her gestational age.
Yes.
Like I see a little bit through. Like I've seen one before that has all the circles, like all the condyles, right, are encircled with calcification, and that would be like a grade 3 placenta, right?
No,
But-
that's perfectly.
No, like
appropriate.
all of them circled around. Not hers.
Oh.
I'm saying before I've seen it where
like
there's
venous legs?
calcifications all the way around each. I could tell each of the
that's
circles.
aged, yeah.
Yeah. That was a patient who wasn't even due.
Oh, yeah.
She was only like 36 weeks. But yours looks good. So what we're talking about is the bright white spots. Those are calcifications. Like a placenta is only made to last for 40 weeks, right?
Okay.
Give or take a little bit. And so it normally just gets a little older. It's getting towards the end of its term here. But this is normal what we're seeing. Like we expect that it's going to have some in there because you're close to your due date. But it looks really good. And then it would be coming up middle here. So I have to come this way more to the lateral to see it.
Nice humerus.
Yeah. There's your baby's arm bone. Upper arm
She's
bone.
got some nice biceps.
Sorry.
Strong.
I can do this.
So if I'm having to come, like, okay, so midline, I'm not seeing any placenta here.
Right.
And I have to come laterally to start seeing it. It's anterior, more towards the anterior. But
She's doing some movement, so that's some tone there.
and then when I come over here, this is where I'm seeing it
Sorry
the
to interrupt. I
most.
just wanted to point that out.
So would this be like a this would be a lateral
Yes.
placenta.
I agree.
Like so it's on her right side.
Yes.
But more towards the front than the
So
back.
and I would call it anterior lateral.
and
It
then
actually kind of wraps around toward the posterior aspect, so I would call it like a anterior, lateral, and posterior, right. Or right, anterior, lateral.
and there's the head.
Mm-hmm.
And at this point, it would
So
be
it's really
really
smart.
hard to tell. I mean, she's obviously had all her scans and stuff, so we know she doesn't have placenta previa.
Right.
But I mean, it almost,
She's got some hair there.
yeah. See all that fuzzy stuff? That's her hair.
Aw.
At this point, like, if you really had no idea about the patient, you would maybe need to do a transvaginal to
Yes.
tell where your placenta termination spot is.
Yes.
Okay. Okay, so we can do an AFI. See if it would adjust it better for me. Okay, so I'm here, I'm parallel. I'm not really picking up a good, well, right there. But I need to make sure. Ooh,
I'm going
that
to decrease the depth.
looks
Oops.
pretty good.
There we go.
So would you say like this is at least 2 centimeters and just measure to the body part?
I would measure
Right
either
there.
here or here.
Okay. So we're
So-
just doing your fluid.
Okay.
So for the video's sake, we'll measure across first.
Okay. So that's 2.5 centimeters.
Mhm.
So then, and then we'll go down to here. Is that good?
That's great.
Okay.
Perfecto.
And then we're gonna look down here. Get a little shadowing right there.
She's probably all curled up in that corner there. I'm gonna put the color on. So there's cord in there. I would not take a measurement here. And we don't know with that see this is a limb.
Mm-hmm.
There's some shadowing there, so
Right,
that's
and this little
an
bit of
enhancement.
one is not big enough.
Right. So I would think
So
that.
how do you get the computer to know that you're not taking a measurement? Like, because last time, it like,
I would place it here,
okay.
and then
Oh, no, you gotta hit
Sorry.
set.
And-
Oh,
oh.
if you went out of measurement. Set.
set.
And then I would just put it like...
Put it right on top of the other caliper, as close as you can get. I mean,
Yeah.
yeah,
And
just
then
like
that way it takes two.
Yes.
Okay. Because I want it to still calculate my AFI for me.
Right.
Total. But if we have 2 pockets greater than 2, then we know we're okay.
Yeah. Even one pocket of 2 right now is okay.
Is that?
Mm-hmm.
And then, so this one, again, like we're looking like right there.
Ideally, I put the color on each pocket.
Okay. Just to make sure.
Mm-hmm.
Okay.
Do you want to go ahead and do that? So we'll take the measurement off for a second.
I'm gonna scoot up.
Do you need,
Oh, yeah.
you need to? You want to switch your head up? You're feeling lightheaded.
No,
Or-
just too much on my back.
Oh, okay.
I wonder if I can get back. Oh, you know what? I can just click on this one. It'll let me know. See? How about return?
Yeah.
But see, it still did it.
Well, yeah. We'll just redo it. But just to show for the video, to show we need to put color on there. Perfect. So that's showing
There's no
there's no
cord.
cord in there. Mm-hmm. Great.
Okay, so I wonder if we go to,
Report
yeah, let's see, where is report on here? Print.
right here. And then
Yeah, we need to change this from abdomen to stitcher. Her bladder is full.
mm-hmm.
It fills up, I read, like every 30 minutes.
Yeah.
The bladder fills up. It's about like how often you gotta pee.
Mm-hmm.
Placenta.
yeah.
Okay. Here, if you would be, however you would like to lay to be more relaxed here, then we're gonna just try to get some measurements here.
Is the angle of your head okay?
Yeah.
Because if you start to get lightheaded, dizzy, or warm, let us know. We can
Okay.
raise up your head. And turn the frequency down there.
And then
I'm gonna change the depth a little bit.
Okay.
There we go.
So I can see the head.
Mm-hmm.
Now is it gonna be? It's probably.
There you go. See how you just opened up the oval a little bit more?
Okay.
I find at this age they're either looking toward the left or they're looking toward the right. They rarely go face down until closer to delivery.
I would say even during labor they're
Mhm.
looking. Okay.
There's pelvis.
Okay. But how am I?
So since she's like this, you want to change the probe like that. So go counterclockwise. There you go. Here. See how you're more parallel now?
Yeah. I need to come over just a little
Mhm.
bit to get it more center. I need to come up and maybe look down a little bit more.
There
so
you
I
go.
get-
Yes.
Okay. And now.
It gets harder as the bone is getting more calcified to see the structures. You can see.
Oh, and she's three.
She's got some hair though. I can see some hair.
Better.
You had heartburn.
Every day.
There you go. So that's thalamus.
I mean, if I can at this point get like a nice oval shape, even if I can't see, I mean,
Yes. So as long as you're getting the shape.
and let me know if I push too firmly, girl.
Okay.
How many weeks are you now?
38.
38.
Okay.
Yeah, she's our farthest along.
Yeah. This. There you go.
And then which I need to like try to get more this way.
Yeah. If you can. Sometimes they're so. lodged into the pelvis, you can't do the head measurement. So there you go. I think that's great because you're getting the majority of the calvarium.
So then what we do is kind of guesstimate like the head circumference. Like it should be around this way. Okay, let's try it.
That's why the farther along the gestation, the greater the parameter.
Inaccuracy of
Okay,
the growth.
But if I'm going to do the BPD, I'm going to do it from here.
Exactly.
Okay, go ahead.
And then,
Like here.
yeah, so you're getting a nice, yep, perfect. Go up a little bit.
Yeah.
There you go.
And then HC.
There you go.
Right
Perfect.
And then, okay, so I would expect right about there.
Right. I would go in
Right
a little
about-
bit on this side because there's this
Yeah.
black area right there.
Okay, so update.
Go up. There you go. And maybe bring in the lip. You may want to go down on this. Bring the caliper over just a tad this way, and then bring in your lips. There you go. A little bit more, kind of like closer to this side. There you go. And maybe down just a little bit more on this side. This is, you know.
Best work of guesstimation.
Yes, exactly. You said this is your first baby?
Okay.
Alrighty.
So we got the
Excellent.
head. Now we're going to go for the
So-
tummy.
Follow along that
Oh, hang on. Yep.
transverse spine.
So we got the head. And then if I come up.
Here's the heart.
Okay.
And so here's the spine. So, and then
I need to try to get it to. Okay.
So you're at 12 o'clock and you want to be at 3 o'clock.
3
So which
o'clock.
direction are you going to go to with the probe?
Counter.
Actually, you're going to swing around to 3 o'clock. Just very slowly.
You mean
wanna-
like.
So my idea is
See
to
yeah.
bring your transverse spine from this view to 3 o'clock. So then you're going to be going over with the probe. I'm going to turn transverse a little bit more. And then just swing over to mom's belly. There we go. Getting a little bit more of the stomach. Keeping
Okay,
the,
there's the. But that's the spine right there, right?
That's correct. And you're,
Okay.
Very nice. So now you're able to pick up the umbilical vein. Oops, I'm sorry, Leslie.
Right there. Oh, I do see it.
Yeah, that's good.
Okay.
And then you can get a nice skin line around there. Do you see that?
Mm-hmm.
Very good. I'm going to turn the gain down a little bit.
Oh, yeah, that's much better.
Yeah, much better. I'm going to rewind. I'm going to
Oh, yeah.
freeze and rewind.
That
Excellent.
does look good. And then the spine is like right here, right?
Great. So you can see one dot there, another dot there, and there's
Some
another there.
space
Yeah.
right there. Okay.
Excellent. So it's it's good to kind of like don't be
Okay,
afraid to
so
move
Like
the
this was how I
transducer
was
with the third
getting it.
trimester over to the other side. How much did you weigh when you were born?
8
You know.
pounds, 13 ounces.
Okay, so you're a good size, and you're tall too.
Yeah.
How
my
tall
husband
are you?
was, I'm 5'7.5". My husband's 6'2", 6'3".
Okay, this is gonna be a tall baby girl.
I would say like right there.
Go up,
about
go up.
just
See
a
that?
little bit.
A
Yeah, I
little
can
bit.
see that.
Yeah. Great. There's a little bit of dark right there. You want to go in a
Right.
little bit.
Yeah. It's,
I would go out more here. See how it along the line there. Mm-hmm. And then you bring this down. Especially in the third trimester and the farther along they are, you feel like you're changing your calipers. Like, here's another one. I got to keep going back and forth.
Okay.
Great.
Now we're going to try to get the babies. So I see the spine.
You see the kidneys?
Oh, yeah.
Yeah.
Actually, that's a pretty good view.
Yeah. Yeah.
Two of
There's
them
greater
here.
differentiation in the tissue right now.
Okay, so
There's the
spine is
bladder.
still up there.
Mm-hmm.
So I'm just coming
So-
straight up.
Uh-huh. And there's your iliac crest. Oh, she's moving. She's like...
Okay, so then if I know that I'm like at the spine,
So here is hip bone. So you're going to be turning in. And,
I'm gonna go this way because I want to stay with my dot up there.
you're actually going to turn in. Because the baby's femur is probably going like this.
So
Go
let me
farther
start
toward, slide up
So-
to mom's head. There we go.
Spine.
Oh, that's my Surrey.
Oh, I was like, what is going on?
Sorry about that. There we go. There's
So that's
femur.
the femur. So I need to figure out how to.
And so it's most
Make
likely
it-
like this.